cómo podemos usar los smartphones, los teléfonos móviles para recoger datos para el uso a la educación médica. Okay, Anique, welcome, and whenever you want.
Can you see my screen?
Yes, yes.
Okay.
Perfect, perfectly.
Yeah. So today I will talk to you a bit about using smartphones to collect data in research. And we already talked a bit about me, but I am a medical doctor, a research and academic coach among medical students and postgraduates, a public health scientist, and an educational researcher. So I imagine most people use their smartphones every day. And that's kind of what got me thinking to look into the evidence around using smartphones in our research processes. So smartphones are everywhere. They're here, there, and everywhere. And particularly with the pandemic, many researchers wondered this question, what now? So many of their research had to be stopped or paused because of the pandemic, and many researchers were looking for options. And I thought it's really important to consider what the rules are around using smartphones. So I'll tell a little bit about how I came to this space in my research process. So I was interested in looking at students' lived experiences as they went from preclinical to clinical training. I also wanted to be able to research these participants for a prolonged period of time. I wanted a method that would be minimally intrusive. I wanted data submission and storage to be efficient. And I wanted to be able to collect data across sites. So that led me to say, okay, maybe we can use their smartphones to interact with them over time, because I wanted them to submit diaries via the phones. And there were a number of questions that came to mind for me. So one is, how can I be sure that the participants are indeed who they say they are? So I'm interacting with them over the phone. So how can I be sure that they are who they say they are? But also the flip question is true. Can they trust me? How do the participants know that I am who I say I am? Am I legitimate? Am I going to respect them? How am I going to protect their data? They're using smartphones. What will they find when they look for me online? So these are all questions that came to mind. So I went to the literature and just kind of wanted to see what was out there about the rules around using smartphones. And I found a couple questions. So what's the reason for me using the smartphone? Is this choice in alignment with my research question? How am I going to engage with them across a distance? And for how long is it okay to interact with them and have access to their smartphones in this way? So today I will try to help you think through conducting a planned or current study using smartphones or digital devices, and to guide you towards being able to defend your choice to use a smartphone. And I will say that even though I am talking about smartphones, most of what I say will be relevant to other digital devices like computers, laptops, iPads, and smartwatches, which is just anything that has a computer in it. And when I talk about apps and our application, this is a program built for a specific purpose. So all the little buttons on your phone are apps. So how actually can smartphones be used in research? Well, they can be used at any point in the research process, but I'll focus on one point. So they can be used in your literature review. There are lots of apps now that help with managing PDFs and so on. It can obviously be used to have team discussions. It can be used for data collection in both quantitative data through surveys and qualitative data as well, which I'll focus on. It can help in data analysis, team discussions after analysis, and obviously scientific communication through sharing on social websites. But most of what I'll talk about is how smartphones can be used to collect data. So using smartphones to collect data could be quantitative, qualitative, as we said. Can actually be done online versus not online as well. So what that means is, if I use WhatsApp to conduct interviews, that's an online data collection process. If I ask students to take pictures of a particular experience, that's an offline process that they can send later. And then there's synchronous, meaning happening at the same time, and asynchronous, meaning that the interactions are staggered. So synchronous would be if I have an interview occurring at one particular time with a group of participants. Asynchronous would be if I am doing email interviews. So I send questions and they reply, a couple of days later at their leisure. And there are pros and cons for all of these options. So there is evidence of smartphone data collection in the literature, and more researchers are being more explicit about their choices to use smartphones and the limitations and the benefits that that can bring. So for example, this is just one example where, they note that these are the instructions provided to participants, that they recorded an audio message with their smartphone at any time of the day, during or after a shift, that they were, based on what they were experiencing. These researchers were exploring participants during the COVID pandemic, for example, and then these recordings were then shared via email or any instant messaging service. Another study, again, they noted that they also wanted audio recordings via a smartphone app, and they listed the app. And it's really good that we are being so transparent, because this also helps future researchers as well. I'll take you through the do's, don'ts, and don't knows. Some of us may have used smartphones already in our research processes, but there's a lot that you may not have thought of. So this is the table that I will work through, where we have the do's, the don'ts, and the don't knows within planning a research project, thinking about privacy of data, and pliability, which is a word to mean flexibility, or being able to change your research over time. So first, planning. The first do is that you should have a data management plan. And what a data management plan is just a statement or a flow chart or instructions about where data goes and when. So for example, audio diaries will be recorded, then these will be downloaded, these will be saved using codes, these will then be transcribed by a particular service, they will then be de-identified and deleted. So it's just stating where the data will be and when and for how long, when is the data going to be deleted. And this is really important to even submit to an IRB application. So that's having a data management plan. I suggest also trialing apps and your procedures. So for example, in my projects, initially the app that I wanted to use, I realized by trialing it, it was not working in Android phones. It would work in the iPhones, but not Android phones, like the Samsung. So I had to go to the developers and kind of work through that kink, which then made me able to use any phone for my research. Also, potentially seek input from participants and your peers, because participants will be able to tell you the limits that they think you should have on the smartphones. And I'll talk about that soon. And it's also important to identify a communication channel. So I communicated with mine via WhatsApp or email. Some participants preferred text messaging. but it's just really important to have an open line of communication between yourself and your participants for the entire duration of your project. Don't be unintentional, so don't use smartphones just because. They should be in alignment with your research process, and I'll talk about that individually. So don't use them because they're cool. But there's a lot that we don't know. We don't know what the rules and roles of the IRB regarding smartphones are in research. We also don't know whether it's better to use participants' own devices for our research processes and let them just send in audio recordings or track them to monitor their presence on the wards, for example, or whether it's better to give them devices that we provide to them. So these are all things that we don't know yet. So let's think about privacy. So it's really important to consider the privacy of participants, but also bystanders, and I'll talk about that separately as well. What that means is, for example, if participants are taking photographs of something that we wanted them, some experience that they're having, sometimes they can capture people in the background that were not intended to be captured. And that's a privacy violation. So that's something, again, that we talk about at the beginning of the project. Also, anonymize all interactions, meaning remove any identifying data from any recordings or any photos, but be warned that this is not always possible. So for example, photos sometimes cannot be fully anonymized because photos have location trackers within them. And this sometimes makes it really difficult to fully de-identify a picture or a photograph. Don't overstep your boundaries. So come up with boundaries. You know, you're having constant access to your participants, so don't overstep that. Consider setting boundaries at the beginning of the project and don't abuse your access to them. So don't try to engage with them every minute of every day. And we really want to try to also avoid distracted doctoring. So that's a term coined by Papadopoulos, which talks about the fact that medical errors have been associated with doctors and other health professionals being distracted by their cell phones, which have just rang or some notification, which means that they miss an important part of patient information. And for example, in my experiences, there was one project where I sent participants prompts and I realized that they were not responding. And then I found out that the timing of my prompts was around a ward round time, which meant that it was inconvenient for them. And that could also mean contributing to distracted doctoring because they would get a notification that they're supposed to engage in some survey. So that's also something to think about. But again, there's a lot that we don't know. We don't know who is responsible for monitoring digital device use in research. We don't know when should raw data be deleted and from where. Different IRBs will tell you different things. And also legal access to data. So suppose one photograph that was taken by a participant in your study has captured a legal incident in the background. To what extent does the legal system have access or should be allowed to have access to that data? And it's really important to be flexible in your research processes. For example, we saw how I had to change the timing of my prompts, my participants, and allow flexibility in how your participants engage. So for example, I had participants sending audio recordings to me to document their experiences across a transition period. But one participant preferred to type or to send text instead. And I allowed that. So that was me being flexible in the process because I didn't believe that it would affect the outcomes. Don't be unavailable. So you really have to be flexible in your availability to your participants. Suppose you ask them to download an app onto their phones, and that app is draining their battery, or that app has a virus on their iPad or their computer. So you really have to be available to help to moderate those difficulties. But it's not known how much change is acceptable in a smartphone study without having to go back to IRB. So these are all things you should work through on an individual basis with your institutional review board. Again, this is a general summary. Think about the do's, the don'ts, and the don't knows within planning, privacy, and pliability. These are the pillars that you should think about critically when thinking about whether to use smartphones or any digital device to collect data. How would you know that your smartphones or using smartphones will connect to your study process? So smartphones can be used as a means of data collection, which is just when you decide as a researcher to use smartphones because face-to-face is not feasible. So for example, if I use WhatsApp to conduct asynchronous interviews about shame amongst resident physicians, that's me using smartphones as a means of data collection. If I use smartphones as a setting for data collection, there are specific features on the smartphone that I would like to use. So for example, I create a WhatsApp group because I would like participants to be able to interact with each other at their leisure. It's really difficult to get, say, 10 residents together at the same time. And WhatsApp allows me to still conduct that interview asynchronously, meaning at different times. So there's a feature that I would like to use. So that's the setting. Or smartphones can be the phenomenon that you are studying. So the smartphone is the subject being studied. So for example, if I design a study to explore how residents use smartphones to communicate with medical team members and why. So that's smartphones as the phenomenon under study. So again, we think about smartphones being a means of data collection, the setting, and the phenomenon. So these are all things to think about, making sure that your choice to use a smartphone aligns with the purpose of your study. Then we can think about what kind of relationship will you build with participants if you communicate via smartphones. But that all depends on your intention. And there are 3 types of relationships that can occur. You can be a minor, where you're just taking data. So for example, if you are extracting data from, say, a publicly available data like a Facebook group, which is among residents or among physicians or among medical students, to extract data to answer some research question. You're just being a minor, you're just taking information. You can be a gardener, where you plant some seed, meaning that you ask some question of your participants and they give you something in return. So they give you an outcome, they give you some kind of plant after you planted that seed. That could be a picture, that could be a written story, that could be an audio diary, that could be a survey response. So there's some initial interaction before you get something from your participants. Or you can be a traveler, which I was. You literally travel with your participants over time, constantly interacting with them via their smartphones. For example, my participants sent audio recordings to me about their experiences transitioning from preclinical training to clinical training. So you can be a traveler. And importantly, over time, there's an increase in the intensity of the researcher-participant relationship. There's an increase in the dependence on trust. And as we go from left to right, it's more time intensive. So it all depends on your intention in your project. Are you truly journeying with your participants where you then, they need to trust you that they'll be, journeying with you over time? So what are the ethical considerations? This is a very important aspect of my talk today. The first one is that using smartphones actually means that your research project may become invisible over time. Smartphones are used every day, and it's really difficult for some people to remember or recognize that they're engaging in a research project because it's using the phone. So for example, if I am geo-tracking medical students to see where they're spending their time, it's quite easy for them to go somewhere that they didn't really want me to know about, but they forgot that they're a part of this study. So smartphones can become invisible. That's called covert surveillance. And that's a problem. So you have to sometimes constantly remind them, tell them if there's data that they don't want included in the study to let you know, simply because covert surveillance is possible. We already talked about the privacy of bystanders. So the privacy, if you are ever conducting an interview over a laptop or an iPad, and sometimes I may capture in my recordings conversations in the backgrounds of my participants. So those bystanders' privacy is now threatened. That's also something to think about and what happens there. Think about the psychological burden. I asked my participants to send me a recording every week or 2 weeks for 9 months. That's a significant investment into my research project. So think about the psychological burden. In these days, also think about the extent to which is it ethical to engage with healthcare professionals now and ask them to be parts of your research projects, given the immense stress that we are under as healthcare professionals. Also think about the distracted doctoring phenomenon. So when are you sending out your notifications? And then think about the fact that these third-party apps, if I'm using, for example, WhatsApp to collect data, have access to data from your participants. What happens there when do those apps delete the data? That's a threat to your participants' privacy. And if you conduct a study via using smartphones, think about, can you make a coherent case for online data collection based on your research question? Can you explain well how and why sampling, recruitment, and informed consent procedures were done, since you collected data by distance? Can you describe the data types that you collected, the sources, and what permissions you got from your participants and any institutions involved? So what does the future of smartphones in research look like in medical education? So there is room for development of academic focused applications, and I'll share a couple sources for the different applications that can be used for research soon. But think about what capabilities, if we could design the perfect app that we wanted to use to conduct research in education, what would that app look like? So for example, the app that I use is a public health app that I knew about because they do a lot of geo-tracking of participants' behaviors for physical activity. And I went to them and I asked whether this would be possible, but initially they only had the capability to allow recording for 1 minute, which was not going to work for my project. So they extended that, and I was able to have participants record up to 30 minutes at any one time. So think about what capabilities would we want as a field. Also, this is a prime opportunity for global research and true globalization of medical educational research, because using smartphones or digital devices kind of breaks down that barrier, that geographical barrier. So I could conduct a project and include people from Barbados, but also Spain, but also the Netherlands. And quite often in our limitations, we talk about having a single centered study. That's a limitation because it means it's very focused. But using smartphones is an opportunity to really engage now in multi-institutional research across countries. And because there are capabilities now for automatic translation, that also now breaks language barriers. So even though my Dutch is not great, I can engage with Dutch students because I'm able to translate our interactions. So again, these are all things to think about, look into the future and how we can really harness the power of smartphones in a safe way for our participants, but in a really critical, effective way in our research process. This website has over 50 research-focused apps. For example, Light Minds is a nice one. It enables participants to share thoughts and record experiences in one-to-one interviews, group discussions, diaries. Tent Maker, you know, participants will be able to capture pictures and recordings and reflect on them. EthnoHub, which is a cloud-based tool that prompts mobile phone users to email diaries via text or photos. QualHand, which is a different type of app. This one allows you to help you to think through the process of selecting a research process. But there are over 50 apps on this website that you can use in a research process. So think about what you really want to know and then look out there and see if there's a smartphone application that can actually help you and aligns with what you want. So in summary, when you want to use smartphones to collect data, think about your project data and any threats to that. Think about the integrity of your data. Think about the privacy of the data that you're collecting and your participants and protecting that at all costs. And think about being pliable or flexible in your research process because things can happen when you start to bring technology into the research process. I have a few references, including an Amy guide that I wrote about critically using smartphones and apps when conducting qualitative medical educational research. And a couple other references there for you. So now I'll take any questions that you have. You can think about questions if you have ideas that you want to do or questions about anything that I spoke about. And thank you so much for listening to me talking in English. And I hope that you got something from this talk today. Thank you.
Thank you very much, Dr. Atherley. It was a very nice presentation of probably a possibility that we don't use much often in at least in Spain. No?
Yeah.
So I have a couple of questions, but let me see first if the audience wants to ask you something. A ver, si alguien en la audiencia quiere hacer alguna pregunta, incluso si no os atrevéis con el inglés, pues me podéis decir en español y yo le traduzco. ¿Quién quiere hacer alguna pregunta? Who want to be first asking? Beatriz, you should speak well English.
Now is my camera on? No.
Yes.
Oh, I click it twice. That's why I switch on and off all the time. Maybe now. Yeah, it's on.
Yeah, it's
okay.
good now.
Oh, thank you very much, Anique. It was a great presentation and it's very interesting. It opens many possibilities here in Spain. And I just could say that you published your results in the Amy guide. So I just wanted to say have a look at it. And thanks very much for your nice presentation. Thank you.
No problem. Thank you so much.
Thank you.